We previously looked at an isolated subscapularis tear, which is a relatively unusual presentation. In this video we will look at an isolated infraspinatus tear, which again is quite an unusual presentation, as most tears in the infraspinatus tendon are subsequent to large tears within the supraspinatus tendon. In regards to positioning, the patient should be sitting with the arm placed across the chest, the probe being placed immediately below and parallel to the spine of the scapula. In this position, the posterior aspect of the glenohumeral joint is well visualized. This includes the posterior glenoid itself and the labrum, above which the infraspinatus muscle may be seen, extending over the posterior aspect of the humeral head to the muscular tendon's junction and then the tendon itself, all lying deep to the posterior deltoid. For the tendon of infraspinatus at its attachment to be visualized, the probe needs to move more laterally, which will give an image similar to this one. Here the tendon can be seen to be nice and echogenic, with its attachment onto the posterior aspect of the greater tuberosity. In the example that we have now, the patient was a 60-year-old gentleman who was doing some DIY, felt a sudden pain in the posterior aspect of the shoulder with subsequent weakness into external rotation. Here we can see the posterior deltoid with a large effusion extending over the posterior aspect of the humeral head and glenoid, but it's possible to see no infraspinatus tendon extending over the humeral head, with the proximal stump of the tendon being freely hanging within the large posterior effusion. If we continue the video and compress the fluid with pressure from the probe, you're able to see that the tendon hangs freely with no attachment.